This is SSN.
Story Studio Network.
I'm Tom Hoppe, and I'm your host of the Most Painful Podcast. On our last episode, we spoke to Dr. Pavlos Bobos about regenerative osteoarthritis and the research his team's been doing on all the different treatments that are available for OA. And they've been looking at what works and what doesn't work. This was a full-packed episode with lots of information, so if you missed it, you can listen to it on our Spotify or Apple feed. It's important that the audience lets us know what topics are important to you. And we had one request to talk about menopause and how it impacts chronic pain. So today I'm joined by Dr. Sarah Vadeboncoeur to talk about this topic. Sarah, welcome to the show.
Thank you for having me.
So Sarah, maybe you can start with just a quick introduction, and then we can jump right into the topic.
So I'm a naturopathic doctor who has a clinical practice in Ottawa, but I serve patients all over Ontario. And most of my patients are women in their 40s and 50s who are starting to see changes in their health and how they feel. And they're often wondering if what they're going through is perimenopause and menopause. And so the work that I get to do, which I love very much, is supporting women through this transition, because it is a very natural and normal thing that all women will go through if we live long enough, but it's not always an enjoyable thing to go through. And so much of the work that I get to do is really to help counsel and support women through this transition so that they can maintain a good quality of life, but also helping to set them up for what the next stage of their life is going to look like post-menopause and some of the things that can show up in this stage. So that's what I get to do, and I love it very much.
So maybe you can start off tell us a little bit about the topic today, and then we can go from there with some of the questions.
Sure. I'll start with some definitions because there still is a lot of confusion around the words perimenopause and menopause. So menopause is really one day in a woman's life. So I always think of menopause as the finish line after a long race. Menopause is the one day where you have had no periods for a whole year. Any day after that is considered postmenopause. And then the years that lead up to that, so kind of that marathon leading up to the last day, is perimenopause. On average, perimenopause will last about 4 years, but for some women, it could be up to 7 to 10 years. Most women in Canada will go through menopause. So again, their periods will stop, usually around age 51 or 52. But it's normal to have your last period anytime between ages 45 and 55. So if we kind of subtract 4 years from that, women can go into perimenopause anytime from their mid to late 30s all the way into their mid to late 40s. And that's often where women will start to feel different. That's often where symptoms will start to pop up, is because hormone levels are really starting to change as the body kind of winds down, and your ovaries basically are essentially going into retirement is probably the best way to think about it. So as they wind down to get ready for retirement, the hormone levels really start to change. And that's what triggers a lot of the symptoms that we associate with perimenopause and menopause.
Yeah, and I've been doing some reading to prep for today's conversation, and it's interesting how it impacts everything. Correct me if I'm wrong, obviously, blood pressure, heart disease, chronic pain,
yes,
moods. I mean, it's just a bunch of impact, or a lot of impact on a person's health.
Yeah. Well, because we have hormone receptors everywhere. So we have hormone receptors in our brains, in our muscles, in our bones. So when those hormone levels start to change, literally every part of your body is going to be impacted. And that's why we see symptoms that can show up in all kinds of different places.
So when we talk about chronic pain, maybe you can just kind of expand on how that connection is made between, I mean, you talked about hormones, I understand that point, but is there, what else would impact chronic pain when someone's going through this transition?
So we know that more than 50% of women going through menopause, so whether or not they have chronic pain before, even if they've never had chronic pain, we know that more than 50% of women going through menopause are going to have musculoskeletal symptoms. That can include joint pain and stiffness. It can include muscle pain. A lot of women are now also noticing frozen shoulder seems to be something that often pops up in that perimenopause transition. So we're looking more to understand how hormones might be related to frozen shoulder. We also know that in that menopause transition, and especially if we look at the 4 years that sandwich a woman's last period, there is a dramatic loss of muscle and bone in that 4-year window around that last menstrual period. So if you are already someone who is dealing with chronic pain, and now you have some of these hormonal changes which impact your muscle mass, your bone health, your joint pain, it's often going to exacerbate chronic pain conditions. And part of why that's happening is that we are seeing through the perimenopause transition, we see a big drop in hormones. So both estrogen and progesterone levels will drop. And the more we learn about estrogen, the more we learn how important it is for healthy joints and bones, because part of what it's doing is acting as a natural lubricant and a natural anti-inflammatory. So when you think of, what most of us felt maybe in our 20s were pretty healthy, fluid, robust joints, that just with age, we know that that decreases, but then there can be an accelerated change through the menopause transition because of the loss of estrogen. So now those joints are not so lubricated and gliding very smoothly. And there's a drop of this anti-inflammatory hormone. And we know that where there is inflammation, there is often more pain. So that's how some of the hormone-specific stuff can really contribute. But the other thing I'll say, which I think is also very important, is that some of the reasons why women might experience more pain through the menopause transition is that most women don't feel great through the menopause transition. And often that is because they're not sleeping well. We know that when we're not sleeping well, we generally are going to have higher pain levels. We know that when women are not sleeping, they move less. So it's been shown that on average, women going through menopause take 3,000 to 4,000 fewer steps a day. So again, if you're not sleeping well and you're experiencing higher pain, and now you're tired and you're stiff, so you're not going for that daily walk, that also is potentially going to exacerbate pain. A lot of women will notice that they're gaining weight through the menopause transition. So again, if there's a significant weight gain, that can sometimes put more strain on the joints and can exacerbate certain pain conditions. And then there's the huge loss of muscle, right? And we know that the muscles are a huge part of what keep our bodies strong and what keep our joints healthy and moving and in the way that we want. So that's, if there's one message I hope our listeners take away from today is that one of the best things you can do for yourself as a woman in your late 30s or 40s or 50s, really no matter how old you are, but the earlier you start, the better, would be to really prioritize building muscle. And I listened to one of your episodes on high intensity interval training, which was excellent. But, building muscle doesn't have to mean you need to spend hours in the gym, but it does mean that we need to prioritize exercise that is putting enough strain on the muscle that we are ideally maintaining and building muscle. Because again, if you don't prioritize that, you're going to lose a shocking amount of muscle. And what really motivates me is that there's a building behind me full of elderly people. And I see a lot of elderly women who are using walkers and canes. And there's nothing wrong with that, obviously. But a big part of why we lose a lot of our independence and mobility as we age is that we lose a ton of muscle. And so if we can prevent that, I think that makes a world of a difference.
Yeah, I fully agree. And that's one of the questions I was going to talk to you about is, we know, I think if I've got my numbers right, we're starting in our 40s, we're starting to lose muscle. And of course, that increases. So for males, that's happening. And now what I understand you're saying is for females, it's a double whammy. Because yes, you're losing muscle at a normal rate that a person would as they age. But on top of that, now as you're going through this cycle, that's accelerated. And I'm 100% with you on this too. I mean, the area I live in there's a lot of retirees in this area, and I see that on a daily basis where people even struggle to get in and out of their car because it's something that hasn't been in their routine of staying fit. I mean, I'm different. My job required me to stay fit, but sometimes it's hard to carry on. And when we think about chronic pain, we know that cycle of, for our listeners who may not understand this, but we have that cycle of, I'm hurting, so I'm not going to be moving.
Yeah.
And then that impacts our mental health, which makes us feel depressed, which makes us doesn't move, which causes more muscle loss, which causes other aches and pains. So I can imagine from a male's perspective, going through, that loss, but to have a double whammy, I guess, would that be the right way to say it?
Yeah.
For a female to be going through, like you're getting hammered with not just regular aging, you're getting hammered with everything else on top of it.
Yeah. Well, and on top of everything you described, now imagine that you're having hot flushes 20 times a day and that you're waking up every night in a pool of your own sweat. So yes, on top of the normal aging process that we all go through, menopause is a double whammy because now you've got this fairly rapid and significant hormonal change that's happening as we get older. So it can make things very, very difficult. But again, part of what I love about the work that I get to do and why I'm happy that we're having more conversations around menopause, so kudos to you for having this conversation on your podcast, is that historically, women have dreaded menopause. Historically, it is a time where women have suffered through it. And sadly, that still sometimes is the attitude that a lot of women have. And we are now in a time and a place where we have so many different effective, safe therapies and supports that can really help you maintain your quality of life. Because again, if you feel better, you are more likely to go to the gym. If you feel better, you are more likely to go for that walk. And not only is that helping you through your menopause transition, you are making a deposit in the bank of muscle, and that will determine what your life looks like when you're 70 or 80. And so if we can kind of look down the road a little bit more, that's honestly, like, I'm 42 right now. And the main reason that I lift heavy weights, which I just went and did this morning, is because I want to be able to get in and out of my car when I'm 80. I want to be able to walk to the grocery store and carry 2 bags home. That's what motivates me right now. And I think we need to start thinking about that a little bit more of, we're not just doing this to look good and feel good now, but we're making a huge investment in our future health when we exercise and we take care of ourselves.
Yeah, and I'd like to get into more of the therapies in a bit, but I think this is so important because, I mean, you lay the symptoms out very clearly. You lay out how it impacts the body. But what stands out to me, and I think it's common in a lot of the podcasts we do with guests, is if you're not starting to get a routine of working out now, I mean, it's never too late, but it can be at a point where I guess it is too late, where now there's a lot of catch up to do. And we know, I mean, from Attia, Huberman, and some of the other, doctors that are out there that talked about this, muscle loss after the age of 65, and you have a major hip break or something. That's very serious if you, like you say, don't have money in the bank. So maybe the discussion should be around, how do we get people to actually see that that's important? And it's great as a clinician that you're leading by example versus just telling a person what to do. You're leading by example. Yes. But in your experience, how can we get the listeners to say, okay, what is that driving factor that's actually going to get them to start now? To do that behavioral change, that long-term behavioral change. Yeah.
What I see a lot for women is that what has motivated many of our behaviors up until this point is weight loss. And so part of what I really encourage women to do is to try to disentangle, especially exercise, but nutrition as well. We need to disentangle exercise for the sole purpose of weight loss. Number one, it's not especially effective as a weight loss tool on its own. But number two, that is such a far away result. most of us who exercise regularly know that it can take years of exercising to see, a significant weight change or even like a significant change in what your body looks like. So what I encourage people to do is, what are the benefits that you're going to get right away from exercise? And can we use those as your marker of success? So some of the reasons I exercise is because it keeps my energy up. It actually, especially heavy weightlifting, and this is true for a lot of women I talk to, it makes us feel more confident. When you can go in the gym and you can squat 100+ pounds, you better believe that that's going to give you confidence that translates into other parts of your life. You said earlier how important it is for mental health, right? I know that I feel better with my mood when I exercise. I sleep better. So instead of thinking about exercise as something that's going to help maybe with weight loss, like down the road, what are the immediate benefits that you can connect to? Because that's what's going to help you feel motivated. If you're exercising for something and that thing is not showing up, that's why people lose motivation, because they're like, well, I'm not losing any weight. What is the point of this? So connect it to your day-to-day experience and how you feel. And the other thing is to just start with something. This is the other thing that we have made exercise so complicated that people feel overwhelmed. And especially with women, there is still this fear that weightlifting is going to make us bulky, which is completely untrue. Believe me, you have to work extremely hard to get bulky. Most of us are not going to get bulky by accident. And now there's this other trend happening where women are being scared off cardio because they're being told that cardio is going to spike their cortisol stress hormones, and that's going to cause all kinds of problems. So women are confused by what exercise to do. They're worried that they're going to do the wrong exercise. And my words of encouragement would be, number one, there is no bad exercise. Just pick something that you like and start small. Maybe you start with a walk that's literally you're going around your block once, and you do that and you call it a day. And then maybe over time you go twice. But, exercise, and for health in general, I find we tend to have this like all or nothing approach that if you're not going to the gym 5 days a week, you might as well not as well go. I do my heavy lifting once a week, and I've been doing that for a year. And I can tell you I'm a heck of a lot stronger than I was a year ago. So it doesn't have to take up your whole life. You just have to start doing something.
And I think it's important for what the topic is today, because if I understand you correctly, it's not just about muscle gain, but when a woman enters menopause, it's about everything else. Am I hearing that correctly? Like it impacts your mental health. It impacts how your hormones are working. So I don't want our listeners to think, well, how do we get from menopause to an exercise show? But it seems to be, my understanding is that it's a cornerstone.
Yes.
Or one of the cornerstones of so many things that can help a person go through that transition. Is that correct?
100%. We know that walking decreases hot flashes. We know that exercise improves sleep quality. We know that it helps with the joint and the muscle. So yes, exercise is not the only treatment. And for some women, it's certainly not going to be enough to treat hot flashes and night sweats. But I can't think of a single health outcome that is not improved by exercise. So it should be a cornerstone that you think about for sure.
And maybe that is the motivation to start earlier when someone is going to go through this part of their life, is that it may help reduce some of those negative, is it negative? Is that the right word? But maybe changes? Would that be more correct?
Yeah, unpleasant symptoms.
Yeah. So the frozen shoulder, you brought that up, so I'm just curious because maybe our listeners may not know what that means, but maybe you can talk a little bit about that quickly, and then we can, finish off with some of the therapeutic treatments that are available.
Sure. So frozen shoulder is the easy way of saying adhesive capsulitis is the medical term, if you will. So it's basically an inflammation of the shoulder where there is really limited range of motion. So one of the ways that I'll quickly screen my patients if this might be an issue is that you're generally going to have a really hard time putting your hands over your head. And the other test for a woman is, what does it feel like to put your bra on? Because to put a bra on, you have to bring your arms behind your back. And with a frozen shoulder, that can be very painful, if not impossible. So those are some of the signs and symptoms that you might have frozen shoulder. It's not caused by menopause, but we certainly see a lot of it when women are in that age. It is an inflammatory condition. And again, there are lots of treatments, whether that's physiotherapy or massage and anti-inflammatories. So,
is it the hormonal changes that are causing that, or is it what is the cause of it? Or
we don't know yet. We don't know. So okay. we've made an association that both these things happen in the perimenopause transition, and now people are looking to see if it's like caused by the hormonal change or it just happens to happen in the same time as the hormonal change.
Okay, so let's talk about. Let's jump into some of the therapies, unless you feel there's something else you wanted to add that we might have missed, and see what's available for people.
Yeah, no, I think we've covered it. We can talk about some of the therapies.
Sure.
So I'll start by saying that the gold standard treatment to manage the symptoms of menopause is hormone replacement therapy, which we are now trying to change that language and use the language menopause hormone therapy. And so that includes things like estrogen and progesterone that you would take either in a patch or a gel or a pill that is there to help alleviate the symptoms. Now, we don't have time to get into a whole conversation about that. What I will say, if you're hearing this and your first thought is that's dangerous and I don't want to get breast cancer, I want you to know that there has been lots of updates in terms of the types of hormones we use and the research that has been done. And the consensus now across menopause societies across the world is that for most women, the benefits outweigh the risks if it is started kind of in that menopause window. So there is still a lot of fear around hormone therapy and a lot of misinformation around hormone therapy. And so a lot of women still are not accessing it. The latest figures I've seen is that I think about 4% of women going through menopause are using hormone therapy. So it's still a very 4%? Small number. 4% of eligible women. So if you're in this window, this is a great time to have that conversation with your family doctor and assess your own risk and make a decision about whether or not that's something you want. But if you are dealing with significant hot flashes and night sweats, like you can do all the exercise you want and you can eat all the healthy foods, it may not treat your hot flashes and night sweats. And that's why we have hormone therapy. So that's the gold standard. Now, for women who prefer not to use it, can't use it, or have symptoms that may not be severe enough that they want to use it, there are natural therapies, and those are things that I use a lot in my practice, whether those are supplements or dietary changes. But essentially, there is no natural supplement that is going to give you your hormones back that are missing. The only way to do that is with hormone therapy. But supplements can be very helpful. Again, if we're looking at muscle, which I know I come back to all the time, like I'll often recommend things like a protein powder if you're having a hard time getting enough protein in your diet. There's some really cool research around creatine, which we know is great for supporting lean muscle mass and seems to have some cognitive benefits. We're also having conversations around nutrition. We know that one of the biggest risk factors for women post-menopause is heart disease. So we need to focus on eating more fiber and more healthy fats. So all I want listeners to know is that there are so many therapies available to you that are safe and effective. So there's no need to suffer through menopause. You deserve to have a healthy quality of life. And there are lots of people out here like me who are here to help you have that.
So might be a silly question from my part here, but is there at some point that a person comes off the hormones and that, you know, the impact of menopause stops impacting heart disease, stops impacting muscle? What's the time frame for that usually?
Great question. So some women will use them short-term just for symptom relief. And everyone is different. So some women kind of, once their period ends, a lot of their symptoms get better. Some women continue to have symptoms for a few years. Some continue to have symptoms for a long time. So that's where we really need to be personalized with our recommendations. A common misconception is that you have to stop your hormone therapy at a certain age, and that is untrue. So you can continue with it if you want to. But our risk for heart disease and osteoporosis, it just continues to go up as we get older, because you're having the age increased risk, and now you're having kind of more years living in a lower estrogen state, and those can increase our risk for those conditions. So,
which is different for males as they age, right? I mean, they kind of stay. I mean, we're going through the aging cycle, but it's not. We don't have that added component, or
it's not the same. So men definitely do, like, your testosterone levels are going to be lower at 70 that they were at 25. That's for sure for most men,
right.
But it's a very slow and gradual decline, and your testicles don't fully retire, whereas our ovaries definitely go into retirement. So our hormonal change happens much more dramatically, and it happens in a much shorter time frame.
Okay. So, yeah. That makes more sense.
Mm-hmm.
I think we could talk about this a lot more. Maybe we might have to do a second show, get into therapies and
I'd be happy to.
Yeah, no, I think it's great. And Sarah, you have your own podcast as well too, right? Maybe you can just let our listeners know about that.
Yeah, so I am the host of the Fatigue Fixer podcast, and in my podcast, we explore all the different reasons why so many women are so tired. So we talk about some of the physical reasons like perimenopause and menopause, but we also talk a lot about the mental, emotional, psychological, as well as societal reasons why a lot of women are tired. So if that is something that interests you, you can find my podcast where you are probably listening to this podcast.
Well, that's great. Well, thanks for being on the show. Really appreciate you being here, and lots of good information. I think the exercise one is a good one to take away. Start now, work at it. Know it's going to be a long time, but it's money in the bank. It's like putting money in your RSPs, right? You're not going to use them now, but we'll use them later on. Yeah, and you'll be happy to have them later. So the sooner you start, the better. I agree with you. Well, thanks, Sarah, for being on the show. So on our next show, we're going to have Cam Kalowski, who's the new operations manager for the Chronic Pain Center of Excellence. And we're going to talk about the advancement the Chronic Pain Center of Excellence has done in research to help with chronic pain. If you want to comment on Spotify or review on Apple, please do, as we're always looking for feedback to help improve our show. If you want more information on chronic pain, you can visit our website at veteranschronicpain.ca or follow us on Facebook and X on Chronic Pain COE, and on Instagram at Chronic Pain_COE. For the audience, stay safe and keep the hope alive.
The Most Painful Podcast
is produced for the Chronic Pain Center of Excellence by Story Studio Network.